Hey everyone, so we will discuss about Faye Abdellah 21 nursing problem. So before that, we have to read the background of Faye Abdellah. So Faye Abdellah is a nursing research pioneer who developed the 21 nursing problem. She was born in New York to a father of Algerian heritage and Scottish mother. Her family subsequently moved to New Jersey where she attended her high school and she was the nurse officer to rank a two-star near Admiral the first Jers and the first woman to serve as a deputy surgeon general. In 1942, she was earned a nursing diploma from Ficton Memorial Hospital School of Nursing, now known as Many School of Nursing. Abdallah considered her greatest accomplishment being able to play a role establishing a foundation for nursing research as a science. Her took a patient-considered approaches to nursing emphasize nursing science and has illustrated change through nursing curricula. Abdallah went to earn 3 degrees from Columbia University, a Bachelor of Science degree in nursing in 1945, a Master of Arts degree in Physiology in 1907, and a Doctor of Education degree in 1995. She believed that nursing care should be based on research, not art of a care. She is a prolific author with a more than 150 publication. Her publication include better nursing care through nursing research and patient-centered approaches to nursing. She also developed educational materials in many areas of public health, including AIDS, hospice care, and drug addiction. So we have the 21 nursing problems theory. So before I start for the 21 nursing problem, so I'm gonna read the description of this theory. Abdellah's typology of 21 nursing problem is a conceptual model mainly concerned with patients, needs, and nurses' role in problems, identification using a problem and analysis approach. So we have the nursing problems fall into 3 categories. We have the physical, psychological, and emotional needs of clients, types of interpersonal relationship between the nurse and a patient, common elements of client care. So she used Henderson 14 basic human and nursing research to establish the classification of nursing problems. So we have the problem solving. Is the process involves identifying the problem, selecting pertinent data, formulating hypotheses, testing hypotheses through the collection of data, and revising hypotheses where necessary on the basis of the conclusion obtained from the data. So we have the 4 classification of the 21 nursing problems. So we have the basic to all patient, sustainable care needs, remedial care needs, and the restaurant.
Basic to all patients. Number 1. To maintain good hygiene and physical comfort. Maintain good hygiene and physical comfort. Ensuring cleanliness and comfort help patients feel better, prevent infection, and support healing. Number 2. To promote optimal activity, exercise, rest, and sleep. Promote optimal activity, exercise, rest, and sleep. Balancing movement with adequate rest help maintain strength, energy, and overall well-being. Number 3. To promote safely through prevention of accident, injury, or other trauma through prevention of the spread of infection. Promote safety and prevent infection. Preventing accidents, injuries, and patient safe, and reduces complication. Sustainable care needs. Number 5. To facilitate the maintenance of a supply of oxygen to all body cells. maintain oxygen supply to all body cells, ensuring that the body gets enough oxygen is vital for cell function and survival. This involves proper breathing and circulation. Number 6. To facilitate the maintenance of nutrition for all body cells. Maintain oxygen supply to all body cells, providing adequate food and nutrients support growth, repair, and energy production. Number 7. To facilitate the maintenance of elimination. Elimination, helping the body remove waste through urine, stool, etc., prevent toxin buildup, and maintenance health. Number 8. To facilitate the maintenance of fluid and electrolytes balance. Maintain fluid and electrolytes balance, keeping the right amount of fluids and minerals like sodium and potassium is crucial for normal body function, including heart and muscle activity.
Sustainable care needs. Sustainable care means providing ongoing support to maintain a patient's current health and prevent further complications. Goal to preserve stability, comfort, and well-being. Example, a patient with diabetes needs sustaining care such as daily insulin injection and blood sugar monitoring to keep a condition under control. Remedial care needs. Remedial care focus on correcting or improving a patient health condition that has already been affected by illness, injury, or disability.
So this is the nursing meta paradigm of Faye and Abdellah. So first of the 21 nursing problem, we have the person. She described nursing as an individual and families, although she does not delineate her belief or assumption about the nature of a human being. So the person is she views the patient not just as someone with illness, but as a person with physical, emotional, and social and spiritual needs. Abdellah that believed that nurses must understand the patient as a whole, including fears, attitude, lifestyle, interpersonal relationships. So a person is a unique being with different needs that must be identified and solved by the nurse using the 21 nursing problem.
Environment. Number 1. Society is included in planning for optimum health on local, state, and international levels. However, as Abdellah further delineated her ideas, the focus of nursing survive is clearly individual. Society role. Healthcare should be planned not just for individuals but also at local, state, and international levels to achieve the best overall health outcomes. Number 2. The environment is the home or community from which patients comes. Environment meanings. The environment refers to the patient's home or community from which influence their health habits and recovery.
So the nursing is a helping profession which included doing something to or for the person and providing information to the person. It is a comprehensive service to individuals, to families, and therefore to society. So nursing is included identifying nursing problems and providing care through with 21 specific nursing function. And nag-help din siya ng patient to become self-sufficient. The next one, we have the uses of 21 nursing problems and the nursing process. So number 1, assessment, nursing diagnosis, planning phase, implementation, and evaluation. The next one is the assessment phase. Assessment phase is a nursing problem to provide guidelines for the collection of data. A practice of underlying the problem-solving approach is that for each identified problem, pertinent data are collected. Collect the data about the patient, that physical data, vital symptom, pain levels, emotional, physiological data. Or assessment of the theory is the step where the nurse gathers complete patient data and identified what nursing problem exists based on the 21 nursing problem. Assessment identifying the patient nursing problem based on the Abdellah's 21 problem.
Nursing diagnosis. A nursing diagnosis is a clinical judgment made by a nurse about the patient's response to actual or potential health problem. Each health guide what as nursing or intervention are needed. For example, problem, difficult breathing. Nursing diagnosis inferred gas entrance related to airway obstruction as evidenced by shortness of breath and low oxygen levels.
Hey everyone, so our topic today is planning phase. Number 1, the result of data collection would determine the client's specific, overt, or covert problems. Data collection result. After gathering information about the patient, nurses identify their specific problems. This can be overt obvious issue like pain or wound, or covert hidden problems such as anxiety or internal discomfort. Number 2, these specific problems would be grouped under one or more of the broader nursing problems. Grouping problems. Once identified, these problems are organized under broader nursing categories to help plan effective care and prioritize intervention.
Implementation. Implementation is the action phase of nursing process. This is where the nurse carry out the care plan. It includes performing nursing intervention to meet the patient needs. For example, for the above diagnosis, implementation may include.
Next one is the evaluation. Evaluation is the most appropriate evaluation will be the nurse progress or lack of progress toward the achievement of the stated goals. Evaluation is the phase that where the nurse checks if the patient nursing problem have been solved, reduced, or improved. Abdellah is emphasized that nursing shall be goal-oriented and problem-solving, so evaluation is done to see whether the 21 nursing problem have been addressed. So the theory of that is the step where the nurse determine if the nursing intervention helps solve the patient problems and whether the 21 nursing problem were addressed successfully.